Hello and welcome to the Pediatric Network. My name is Mike Marinas, and if you work in a country that's similar to mine, this is your 9 to 5, wearing a mask while working with patients or even just being out and about. So it's either going to be a surgical mask, or it might even be an N95 respirator or an FFP2 or whatever it is. It covers a lot of the emotional content of what your face normally portrays. And it does exactly the same thing to children when we work with them. I've had a couple of experiences where I've worked with kids, and I've really found it tough to be able to work out what their emotional state is. So, because of that, I decided to get hold of a good friend of mine, practicing psychologist Adele Romanis, to be able to come onto the Pediatric Network and give us her top 5 tips of staying connected to pediatric patients while we work with them in practice. Hello and welcome back to the Pediatric Network. My name is Mike. I'm your chiropractor and host here for all things pediatric. So today I've called a good friend of mine, psychologist Adele Romanis, to come and join me on the show. How are you doing today?
All good, all good. You?
Cold?
Freezing.
It's crazy up here. So the reason that I've asked Adele to join us is I had a bit of an experience when I was working with, I think the child was probably about 3 or 4. Obviously, we're all in masks now, and working with a little girl, and thinking that everything's going well, and then all of a sudden, I just see this little tear pop down the side of her eye, and I'm like, my heart breaks because I should have held back. I should have known to hold back. I'm good at doing that when I can read the cue of their faces, and now I'm in a little bit of dwang because I can't read those. So I called Adele and I was like, please, if you have any tools for me and my mates who are sitting and working with kids, please, please, please help us.
Okay, so there are no tools out there as per any research because, this has never happened before. So this is pretty much what I can come up with. Obviously, it's a work in progress, so people can add to all of this. I see you've frozen. Okay, you're back. So the whole thing is, obviously, like you say, people are like covered in masks now. You can't really see their faces. You can see their eyes. So we're going to have to work with their eyes to give us as much information. So just to give people a broad understanding is that, and most people don't know this. They often get it mixed up, is that our non-verbal communication is 80% of how we communicate, rather than what people think is the other way around, is the 20% of verbal communication. If you ask most people, they say, no, what people say is what they mean, but actually you can make yourself say anything you want to. So the whole thing is this aspect of, now you've got their facial expressions, but now you don't have anything. You've got their eyes.
Yeah.
So really, like I said, you've had some skill without even realizing it, by the fact that you work with babies, because they don't speak, first of all. So there is already, you're not that bad.
They're a tough crowd.
They are a tough crowd, especially when you've got the moms who are very vocal
Sure.
on what to do. So there's I've just been thinking of ideas in ways of, I just want to check out, we're doing chiros, we're doing physios, who are we targeting?
Yeah, so we got tons of people on. So we got like chiros, physios, osteopaths, we'll have lactation consultants, we'll have, anyone basically who's working in the field of pediatrics we'll have on here, we'll have watching. Okay,
so I think, a lot of kids themselves are quite tenacious and do adapt quite well to the current situation. So if they're in school going age, it's also normalized because they are going to school every other day, depending on the school system that they're in. So that has become norm, that they're seeing other people, and they're also out and about sometimes with their parents in the shop, seeing people walking around with masks on. So that sets the norm for it. So what you can do is relate to this of how, firstly, build rapport with them. It takes 30 seconds, a minute to find out, how they feel about wearing a mask. because
Sure.
I don't like wearing masks. I actually sit in my sessions and I can just feel like I'm constantly yawning when I have it on, because I don't think I'm getting enough oxygen.
Yeah.
Not that the person's boring. It just, when I consult online, there's a big difference. So
I sit with a mask on like this all day.
Yeah. And then you kind of like lift it up just to get a bit of fresh air underneath it, so that you don't,
True enough.
pass out in the middle of the session. Okay, so the first, a couple of things that I kind of came up with was building the rapport with them. How's it going? Like, you're one of the superheroes, because I think President Ramaphosa is kind of emphasizing that everybody needs to wear these masks, and that, it's a brave thing to wear masks. They're not very pleasant. I haven't come across anybody that goes, yeah, I'm loving wearing a mask. Besides a bank robber, I haven't come across anybody else. So it's not a comfortable thing to wear. And you guys are working in close proximity, so you have to wear these things. And are you wearing a shield as well?
Yeah, most of the time. Well, actually, in fact, now, mouth covers and face covers, yeah. Okay,
all right. So it creates this distance. It creates this like, wow, this is a scary person. So as much as you're scary going to the doctor, now you kind of go, okay, now this man looks like this robot. I mean, we haven't got into the suits yet, but I think we might get to that point soon.
Yeah.
So first thing is just to build a little bit of rapport with the kid, or the person, the child, the adolescent, the adult itself, say, okay, cool, how are you managing with these masks? And relate to them, to say, what, these are pretty yucky times, but we have to do this. It's, you're pretty much a bit of a superhero for keeping your germs to yourself, and me keeping my germs to myself.
I like that.
Yeah.
Gives them.
It goes well with kids. Cool. And then maybe that's, some kids might not like superheroes, but most of them do. And then kind of go with what superhero they like best.
Okay, so really tapping into
what's the power. Yeah, just kind of like go with what's a superpower. Do they like? Are you gonna have to, get a bit more knowledgeable about superpowers and cartoons and things like that. But
I'm okay. I'm pretty good.
Yeah. All right. So kind of get into what's your what's your superhero's power. That type of line, likes to turn himself invisible. Okay. Well, let's talk about that. So you can work on them while you're having that conversation, because you're also distracting them from that.
Okay. I like that.
Okay. And then they don't even realize, and maybe they might realize into it that what you're doing, isn't so helpful or painful to them. So there's another element you can also add to that, depending on the child, is also kind of giving them some sort of ratio or radar to say, okay, cool, I'm going to be working on you, and I want you to tell me how good I am.
Oh, I like
and give them the power to rate you. Right? So say like 1 is terrible. Okay, 2 is cool, and 3 is like fantastic. All right.
Okay.
It also goes with you can also use it with the pain kind of ratio as well. So you give them a measuring skill that and you share it with them. So they can like either, I don't know if you're able to like hold your finger, for them to hold your finger, depends on what manipulation you're doing with them. But maybe them going 1 if it's sore, or 10 if it's, depending on which way you go with the scale.
Like that.
So that you have some commonality, because now you don't have anything to see. You've got the eyes, and then you feel horrifically horrible and guilty when you see tears coming out of their eyes.
Yeah. And it's also, I find that why I resonate with that idea so much is I think I know that a lot of the time for kids to say to an adult, stop, it's sore, when they have been explained to by their parents that you're coming here, don't complain, don't, a lot of that is their build-up. And I think if we, as the therapists working with them, give them the efficacy to say, look, you are loud, and we're going to do it in an easy way. So it doesn't have to be, oh, I'm sore. So it doesn't have to be the thing mom and dad were talking about. I'm actually giving you your own little scale that's just mine and yours, and we can use that. And if you don't like it, you tell me where you are on the scale. That's magic.
So I think also to be adaptable, because you are the practitioner, is for them to say, okay, how about we do 1 to 10, depending on the age of the child. So now if you're like in an 8-year-old, 1 to 10 is fine, but you can't ask a 3-year-old to do 1 to 10 if they can only count to 5. So, look at, say, okay, you need to be realistic of going, okay, we're doing 1 to 3 with little baby, kids under 5, and we do 1 to 10. So you kind of standardize it, but you also make it unique to say, okay, which do you want to be? Do you want 1 to be horrible and 10 to be the best? Or do you want 1 to be nothing and 10 to be the worst? So you also give them some sort of degree of control and power over which one. You've just got to be on guard in regards to, don't do a 10 with 1 and then the next one is a opposite way around and you get confused.
I get you. Yeah, that could be a problem.
Yeah. So it's about just being, workable with what the child comes in with you.
I like that. I really, really like that. So it's almost it's individualizing each session with them, giving them the ability to be able to tell you where they are in their head, and then initially just building up a rapport with them so that you can go, almost like make it safe for them to be able to then give them a scale to be able to work with you.
Yeah. Now that's that. Yeah, absolutely. Another alternative, just because you mentioned the word safe, is obviously depending on the developmental stage of the child. If, sometimes saying 3 is a bit difficult, or 10, because they have to think about the scale and where on the scale it would be. So the smaller the scale, the less choice they have, kind of 1 to 3, right? But if you want to, you can also use the opportunity of saying, okay, well, let's have a safe word.
Okay.
So give me a safe word. You come up with cupcake, something like a 1-syllable. Cupcake is a bit long. To say red. So that they can say, okay, cool. No. We're kind of pushing the boundaries a bit now, just to ease up and then chat to them about it. Because remember, there's a whole lot of anxiety going along with who this strange person is with behind this mask. And remember, as much as you can only see their eyes, they can only see your eyes.
Good point. Yeah, so they can't judge if I'm trying to...
If you've got long fangs like Dracula, they can't see that.
Exactly. Wow.
Yeah.
There's so much to unpack with this, man, because it's such a crazy time. And like you said, just as we started, there are no rules. There's no research on stuff. There's nothing to tell you that you are supposed to do this or you're not supposed to, or how do you do it. And that's why I thought, just let me get you on, because we can get, we don't have to have, let's just start building from the bottom up. What makes sense, and what kind of tools can we try and use just at the moment to be able to go make it an easy experience for everyone. Yeah.
There's no set guidelines whatsoever. But my suggestion would be to be as person-centered or client-centered or patient-centered as you possibly can. Talk to them continuously. Talk about stuff that's relevant to them. Find out, that's what I'm saying, build rapport with them in the beginning. What's your favorite thing to do? What's your favorite food to eat? What's your favorite sport? Who's your favorite sportsman? Not that there's much sport happening at this point in time, but something that they can.
Yeah. Can I ask you as well? I suppose it's not really off the topic, but it's nothing we spoke about before. But I'd just like to get your take on this, because I've definitely found what I think is an effective lockdown of these kids not being socialized, especially when I'm looking at like the toddlers moving in. Those are kids that would have been really socialized, seeing a lot of people and learning how to interact. Now you have kids coming out of this bubble, and now there's a new person. And now not only is it a new person, but all the things their parents have said, don't touch, don't go too close, this guy's touching, he's going too close. It almost, you can see them jarring in their heads, trying to deal with. So I think there's a huge effect of that, of what lockdown has done. Yeah.
No, absolutely. I think there's going to be a huge gap in a whole lot of developmental stages for every child, or even person going through this corona experience, shall we call it, to make it quite enjoyable. So again, I think you spot on in regards to everything that their parents have told you this man is doing to you. So to normalize it while they come in, to say, okay, so yes, we've got a mask on. Why do we have a mask on? Because we've got this virus, and you know, we can't touch this and we can't do that and we can't do this, right? But in order for me to make you feel better, I have to do all of those things. But because I have to do all of those things, this is what I've done to make sure you are safe. I've got this mask on, I've got my shield on, I've got gloves on, I've sprayed the bed, I've done this. So even get them to participate in doing it, because, you know, kids like being involved and spraying.
That's a wonderful idea. That is a wonderful idea. Wow. It's making me think. That's why I brought you on here, because I knew. I knew you were good.
Hey, and I heard yesterday that medical aids have to cover all of your gear. So you know what? If they want to put on a pair of gloves, let them put on the pair of gloves.
Yeah, you're paying for it. You may as well put on a pair of gloves. Absolutely. Listen, thank you so much for your time. I really appreciate it. I mean, I always get a lot out of speaking to you, and I thought that's why, you know, I've got a lot of guys that are in my position, and if I'm having that problem, I'm sure a lot of people are having that problem. So yeah, I think thank you so much for the tools that you've given us now. And as things build and as we know more, I'm sure the evidence will catch up with us. But as you say, at the moment, it's about building your own raft and just making it down the river at the moment as easy as you can.
Exactly. Well, you know what? I was like, oh, what the hell am I going to talk about? Because I've been bashing my brain. So actually, it all came out while we're having this conversation. So
well, I mean, that's where the best stuff is. All the knowledge is there, and we just need to talk to be able to ram those ideas together to give the picture. So I thank you very much for your time, and I'm sure we will have you back on the Pediatric Network. Cool, Adele. Thanks very much.
Fantastic. Have a good one. Cheers. Bye.